Family, family, family. We have giants in our midst. And in this moment, not only do we get to meet them, but we get to give them the credit and the praise that they deserve.
We all have a responsibility here as birth workers.
They are educating, creating, providing resources, doing what they can to make the world better, our world better. This is For the Culture. Hey, beloveds. I am over the moon and excited to be back with all of you guys. Welcome to season 2 of For the Culture. This is Chocolate Wombs edition. We are talking about all things Black maternal health. Do not go anywhere. This conversation is for everybody. And so buckle up, get yourself prepared for today's guest. Before we jump in, you guys know the deal. Please like, subscribe, comment. I need your help in order to share this information with the world. It's itty bitty me. We're learning, we're growing as we go. And I'm really grateful that you guys are here to be a part of this journey. And so without further ado, I'm going to go ahead and welcome today's guest and have this powerhouse go ahead and introduce herself. Hey, boo.
Hello, how are you doing? Thank you for having me.
I'm better because you're here. Please let the people know, who are you?
So my name is Natasha Cupidore. I am a pediatric nurse practitioner as well as a pediatric palliative and hospice care nurse.
Mm-hmm.
I've also worked in NICU, PICU, PEDS, and I'm also a doula.
Holy moly. So this is going to be a fun conversation because you just said a lot of different areas there and I'm going to touch on everything. So thank you again so much for being here, for carving out the time in order to share your wisdom with us. And I had the pleasure of meeting Miss Cupidore. What was it? I think it was the first Chocolate Wombs event. When I first got to meet all of the doulas, well, not all of them, but many of the doulas in the neighborhood. And you came and shared your wisdom and you were a really active participant. I'm really grateful for your time even then. And I learned about you and your business and all the work it is that you do. And so let me ask you that from right now too. Can you tell us about your business as well?
So I run 3 different businesses. My first businesses. So my first business is it's called Cupid Hands. It's a women's health concierge service. And it is run by myself and one of my really close friends, Janelle, who is a midwife, right? We had the crazy idea that women's health is not just about women. It's about maternal, right? Maternal child. So we, as young nurses, set out to conquer the world. And for us, that meant conquering women's health, right? I think a lot of people tie a lot of diseases to a lot of things, and it does play a part. But I personally believe that if you can empower women, not just pregnant women, just women in general,
right,
to really understand their health, to take it all as important, their spiritual, their mental, their physical,
right,
their emotional, if they can learn how to do that even prior to being pregnant, then they'll pour into their children that their children will then have better health habits. And I personally think that's how we really change the narrative of what health looks like. So for us right now, yes, we are focused on the maternal part of it, but it's really like a holistic kind of thing, making women understand that what mental plays into pregnancy, how mental plays into their health, the importance of their health. Because I think, especially as Black women, we put everybody first, right? You make sure your husband has his doctor appointment, kids have their doctor appointment, your parents have their doctor appointment, and then you're like, I can change my doctor appointment. No, your doctor appointment is important as well. And if you can't go to the doctor, we can come to you.
That's
so
good.
Our service is actually offered in the home. You can do pap smears. We can do your annual checkups. We're in the process of getting onto insurance panels. So, for right now, it is an out-of-pocket expense. But we are trying to do things like include FSA, so that if you have those type of, benefits, there's a way for you to utilize it and still be able to see us. My doula service is also underneath them as well. So I think a lot of people, when they think about a doula, they think they have to have like this perfect pregnancy in order to have a doula. And you don't. I think especially if you're high risk, that may mean that you may need it actually even more. You need someone to help support you, ask the right questions. I think what makes me a little bit different from other doulas is I do have that medical piece, right? I'm able to show both worlds, right? So I'm able to give you the Eastern wisdom, right? But also understand how medicine can play within it and how we can use both together to be our superpower. And you don't need one or the other. We can use both and come to a happy medium where you still feel heard, you still feel empowered, but we're doing what needs to be done. Because I think we're in a very rocky world in which we really feel like medicine is the enemy, and it's not. I think a lot of us don't realize, because we see such great outcomes, how privileged and how blessed we are to see these outcomes. Like, there was a period of time that children did die before their first birthday, which is why the first birthday in a lot of cultures are celebrated so highly, because children did die, right? A lot of women only had one child and they died in childbirth. We forget about that time period, and it's okay. But
that's good.
We need to, I always describe healthcare right now as we're in therapy. And yes, we need to do better. We need to call it what it is. We need to say, I am at fault, but we're in therapy and we're working through it. So part of what I do within the maternal world as a doula is I help work through it. What are your fears with going into the hospital? What are your fears with this particular provider? Let's see how we can meet you where you're at. Help my patients advocate for themselves, feel comfortable with who they are, and what they want ultimately, right? But within understanding that you can deny everything, you can accept everything, but I want you to be informed with whatever you decide not to do and whatever you decide to do. It's not just okay to say, well, my mom told me to do it, or, I mean, I've had that doctor for 10 years. I don't really like her, but that's not okay.
We're not doing that. We're not doing that.
We're not doing that. So that's
question
Cupid
under
hands.
that. Cupid hands, your you as a doula falls under that business. Are you a full spectrum doula?
I
do you have
am.
like specialty? Okay.
So I am a full spectrum doula. I always tell people that I don't think I'm morbid, but I always feel like I see the beauty. Maybe that's the reason why I do like both hospice and birth, right? I think those are the two areas that you get one shot to do it right. You have one shot. So you really, it lasts, the memory of it lasts forever.
That's good.
So I help women through miscarriages, through abortions, through birth, and everything in between.
Powerful. Okay, thank you for that. And then so that's Cupid's hands.
That's Cupid's hands. Then we have Hands and Heart of Cupid. And that was actually developed based on my love for peds, right? I've always been a pediatric nurse. I've been a pediatric nurse for more than 20 years. And I really think that kids are the bomb. Like, they are the most resilient. Adults, we're weak. Kids are phenomenal. We really are. Kids are phenomenal.
It's a huge difference.
Yeah. I have a patient actually that's having surgery today and on her brain, and she's like, I'm just gonna be smarter after. And I'm like, yes, you are, baby.
Period, Pool. That's the energy.
That is it. An adult, we would have been thinking about everything. Like, she verbalizes she's scared, but I think we spend the last couple of weeks like really prepping her, letting her know what's going on, letting her know how important it is post-op to take all her medications, and we're not going to be able to do the same things again for a little bit, and really trying to get her to understand, is she going to probably try to do these things? Absolutely. Because that is my fireball and that's what she does. But they're the best. Kids are the best. So Hands and Heart of Cupid was actually born through actually her, because she's been my patient since she was about 2 and she is actually 12 now.
Wow.
So it was her and another one of my patients was when I decided to be an independent contractor. And like I said, I've always seen the beauty in children. There's a nursing therapist, and her name is Roy, and she was actually a nun, Celestila Roy. And the way she approached health was that if you adapt to it. So the easiest way to describe Roy adaptive theory is, I always describe it this way: if you have a paper cut and you are unable to use your hand, you're like, oh my God, my finger's hurting me, I have a paper cut, then according to Roy, you're unhealthy. However, if you get your arm amputated, you are righty, you get your arm amputated, even if it still has gangrene coming from it, but you are able to learn to use your left hand, even with the gangrene and the sepsis that's coming from it, you are still considered healthy because you are adapting to your situation. And I think that works so well for peds, especially when you have families that have children with complex disorders. This is a new reality for them. You know, you birth a child and you expect them to walk and talk and do all these things. That may not be your reality, but that doesn't mean that we can't be healthy. Doesn't mean that they can't have a full life. And we're going to figure this out together, how to have a full life. Whether that means that they may need a G-tube. So I might start training a family how to use G-tubes and how to change them. Whether that means that we're connecting with community and figuring out who's the best PT in the area, how you can get PT, OT, and speech at home and get it the way you need to have it. Powerful. So I kind of like play like that liaison in those areas, as well as I do like medication reconciliation. So like if families are trying to learn about medications because they're, you know, like their baby or their loved ones are coming home, I'm able to do that. Or if they're just like, you know, I feel a little bit uncomfortable, the baby's just coming home and my son is coming home for the first time after a spinal cord injury, you know, can you come and just show me the ropes at home, or what can I do to make this house more safe? Like a lot of people don't know, if you have oxygen in your home, you can call the fire department and they give you a sign to put in the home, and that becomes a designated area. So unless there's a fire in that particular area, a lot of times the child's room becomes the area that you would go to, and the fire department would know because you would be registered with your local fire department, and they know if there is a fire at this particular place, this is where we go to. That's so you have a rescue plan within your home, and the fire department know where to go to. So like this little tidbits like that is what I try to share with my family.
That's powerful.
And just teach them what health is, right? Health is about adaptation, and that's honestly the truth. It's about adapting to your situation. So Hands and Heart of Cupid is that. It also has, I have an in-home daycare under Hands and Heart of Cupid. And it's an inclusive care, right? So when I was younger, I actually went to a school that not only had children that had both physical and medical conditions, but they also had children, quote unquote, that would be normal. And a lot of studies have shown that if you put a child in an inclusive environment, they really become more empathetic to the world. They see the world a lot differently. I always give the example, people will see someone in a wheelchair and yell at them, like, do you need help? Their feet aren't working. They're not deaf, right? Or they'll be like, oh my God, she's so smart and she's in a wheelchair.
You're like,
her feet are not working. That has nothing to do with her intelligence, right? So it kind of allows you to not see those things. And not in the way of like, I don't see you because you're white, but just understand that, you know, that doesn't define someone. Not being able to see, or not being able to hear, or not being able to walk, or being, you know, having a G-tube doesn't define you as a person. It's just a part of who you are. So that's part of what I do. Those are my two. Oh, and then my third one, which is more, I run it with my husband. It's a construction company. It's called Steel Pan Welding. And and I'm Trinidadian. And it was really established because I saw his frustration as a West Indian welder within the system who knew a lot, but wasn't necessarily given the opportunities. Or even when he was given the opportunities, it was more so of someone else took credit for his work. So what happened was that in the middle of the pandemic, I had given him an LLC for his birthday, maybe like the first year we were together. And then in the middle of the pandemic, he got his first 6-figure contract, and we had no idea what we were doing. He was supposed to have the contract with one of his friends, and they pulled out.
Wow.
And I was just like, go to bed. I'm going to figure out how to do this proposal. Because he was like, I'm not doing it anymore. I'm like, don't worry. I'm going to go on YouTube University.
We're going to figure this one out, okay?
We're going to figure this out. And apparently, however I wrote the proposal, one, they were just like, can we hire the person? I'm like, I don't even know what I did. And two, he actually got the contract. So that was like our first contract, yes. So slowly but surely, we've been working all three in. And actually, this was my first weekend where Cupid Hands was running at the same time as Hands and Heart of Cupid. And it was tiring, it was exhilarating, but it was on mine, and I was so proud of it. He helped me with the daycare. He made sure that my kids that were in the daycare this weekend were taken care of. I was running back and forth to my patient who was in the hospital. So it just really, really worked out. And in between, I was taking calls for steel pan welding and, writing emails back and forth in the middle of, like when she was, it was a weekend. Tiring, but I loved it all.
That's amazing.
It was.
Let me do this before.
No,
truly. So this is the epitome of what I am enjoying about this and having the YouTube is just being able to bring folks that we walk by every single day to the forefront and recognizing their gifts and their talents and their contributions to our world. Because, for example, I don't have any children yet, but you make it possible for the person I'm working with, right, who needs to have their child in care or needs the assistance when they bring their baby home. Like, we don't realize the domino effect, right? Like all of these powerhouses in our community,
how they work together.
And that keep us going. So thank you. I am so excited again to learn more. I know y'all. I know a little bit. I know all of it. So I'm excited to even here and for us to be able to support you. So let's backtrack a little bit. You have been a nurse for many moons. What made you decide to go into nursing?
To be honest, if you ask my grandmother, every time I felt frustrated in school, my grandmother would say, you've always wanted to be a nurse. You sat on my steps when you were 4 years old, and you said, I'm going to be a nurse. I'm going to take care of kids, and I'm also going to deliver them. And although I am not a midwife, I do support women taking care of them. So I think just having a family history of it, just really being someone who just likes to see people happy, see people healthy. I've always been someone who apparently understood like the individualization of health. My grandmother would say, I would only give my grandpa coffee because he wouldn't drink tea. And I would only do certain things because I guess even as a kid understood okay, well, this makes you happy, but it doesn't mean it's going to make her happy. So if someone would say, make grandpa a cup of tea, it was like, no, he doesn't drink tea. Yeah, it's not going to make his morning. He needs coffee. Right. So I think understanding that. Also, I'm really, really blessed in that, yes, I picked a profession that you can rub two coins together. But I've never done drugs, and my high has always been nursing. I became a nurse when I was 18. I became an LPN, and I've never looked back. I have never looked back. It's my high. Nothing makes me happier than a family member who says, I can go to bed tonight because I know you're my parent, you're my mom's nurse, or you're my baby's nurse for tonight, or I don't mind paying you extra to watch her for the night because I know she's safe. That's the best compliment. It is. It really, really is. And I love it. It's hard work sometimes. My little plea to everybody who wants to be a nurse. It is hard work, but it is one of the most rewarding professions out there. And although you have the potential to make a lot of money, just please remember there's a person on the other side of every dollar you make, and keep that in mind as you move forward.
That's really good. You mentioned a little bit of your tenure in nursing. So when you first became a nurse, what area were you in? What field were you in?
So when I first became a nurse, I was a school nurse. Okay. And while becoming a nurse, I became a nurse as an associate degree nurse. So I was
Okay.
a school nurse, and then I did an accelerated 1-year program, and I got my BSN,
Nice.
and I started working in a hospital. I worked in NICU,
Okay.
and within the NICU that I worked at, we sometimes were floated to like the pediatric floor, the pediatric ICU. So I was able to get exposure to peds, PICU, L&D, and stuff like that. So that's how I got my exposure to other areas. But again, maternal health has always been my thing. I love maternal health.
So what, for the person that doesn't know, what is NICU?
So NICU, I'm sorry, is the
No, it's
neonatal
okay.
ICU. So NICU is really defined as neonate, and the neonate is like the first 28 days of life. So it's a baby that's born either premature or born and needs probably some type of help. Whether it's that full-term baby that's just not feeding, or they can't regulate their blood sugar levels. There are many reasons why babies end up in the hospital, but they end up on this unit prior to going home. Most hospitals, if the baby goes home, they no longer go into the NICU, they go into the pediatric floor. This is like the sterile baby that never leaves the hospital, that's sick.
Okay, thank you for that. Thank you. And important too, because again, maternal health includes so many different aspects, and a lot of folks, I think, who don't know anything about the medical world, for example, maybe have their child and their child now is a NICU, or they're hearing terms and they're like, what the heck is this? So thank you for that breakdown. And also, for the families and the communities that are supporting during those seasons and periods of people's lives. So just thank you for that breakdown. From NICU, where did you go next?
From NICU, I worked at a pediatric long-term care facility called St. Mary's.
Okay.
It's in Queens, it's in Bayside, Queens. And that was really, really, it was really, really informative, I would say, because there were kids that had a lot of different diseases there was one kid that literally, we didn't have a diagnosis for. We literally would just Google her symptoms and treat her and make a plan just based on her symptoms. We had no diagnosis for her.
That's so interesting. What was that like for the time that you were there? Like, what did it teach you?
Again, individualized care. Just individualized care, right? That this is going to work. And you saw her thrive. Because although we didn't have a diagnosis that told us, okay, do A, B, C, D, we treated the symptoms and not the person. And I think a lot of times in medicine, that's where we're missing it, right? We're not looking at how the picture fits together for this particular person. So with that particular facility, a lot of times it made you focus on just viewing the symptoms and how they go together, and not okay, well, the child has this or the child has that, because some of them didn't have diagnosis, or some of them had diagnosed. Like I've had a patient, won't say where, and the parents, because she was the foreman, they were told that she was going to die, told their whole family that she had passed away at birth, and then had to come back. And we're like, well, this baby is thriving in this environment. This baby's not going to pass away. And they were just like, well, what do we do with this information? Because we have already said that the baby's passed away. So then it was like a lot of social work involved, having to help the family tell their other kids and tell their family that, baby's still here.
Wow. Holy moly, that literally gives me chills. And if it, from the viewers, no judgment. And I put that forth because every situation and scenario is so different.
Absolutely.
So who knows what that experience was like, for the parents. But this is also eye-opening again for who the heck even think, like in my mind as a nurse, like I couldn't have imagined that would be an experience that you're dealing with, and now you're supporting a family. And wow, okay. And fast forwarding to now, let us know again what area you're in.
So right now, I primarily work for myself, and I am the doula. So a lot of my maternal work is within being a doula, and my daycare. That's where I'm at currently.
What made you decide to become a doula? You've been a nurse for a million years,
Right?
right? We've gone through your and I'm y'all. There's a reason, right? Powerhouses in our community. You have an extensive background, which I can't even imagine how powerful that is with you dealing with your clients. You know, like as a doula now, when you can see so many different parts of how what you're doing is going to impact them and their families. But yes, what made you decide to become a doula?
So to be honest, I was a little naive. I thought that it was an extension of being a nurse. I thought it was just more like a more concentrated nurse. So when I decided to become a doula, and it was like, okay, you guys aren't access to any of my qualifications, like you don't have to be in the medical field to do this. So it was actually a little I had to switch my mindset a lot to be a doula, because a lot of it is not medically based, right? A lot of it is more of your instinct, Western medicine, culture, history, you know, African traditions. So it was really, believe it or not, very hard for me when I first started being a doula, because I was just like, what do you mean we're not? We need your blood pressure every 10 minutes. And they're like, oh, no, I feel fine. Like, you feel fine? I don't know if you're fine. I need to know. And it's like, no, I'm okay. We're going to drink some soups. We are going to do the things, and we're going to be okay. And although I will admit that I am not the doula who only drinks soups, I need to take your blood pressure, but I will give you some soup while I take your blood pressure.
Right.
I don't necessarily always go against medical advice, but I want you to be informed so that every decision that you make it understanding the pros and the cons of that decision. So I kind of am like in the middle. I'm, you know, like I'm that gray area in that I do still believe in our medical system. I know, don't still tune in after this, guys. Still tune in.
Don't leave nowhere, y'all.
I still do believe in our medical system, but there is a lot that needs to change about how our medical system operates, which is probably why I left the bedside. Because at the bedside, I realized that people didn't see each person as an individual. I realized that I would have families who didn't look like us that would ask a million questions, and everyone was so eager to answer their questions. And then I would have patients that look like me that would say, can I just have an update of my baby? And it's 2 a.m. Why are they calling? Because they want to update of their baby at 2 a.m.
Right, because they asked. You hear what they asked? Okay.
That's it.
So thank you for pointing it out, because doula means so many different things depending on the person. And you know, we're talking about it through the season and have different folks explaining what they, not just what they bring, but also helping the world really get a better picture and understanding of what doulas offer. And so, in your words, you know, what would be, why should someone even have a doula? Why should someone even consider having a doula?
So I think someone should consider having a doula because it's like a therapist. It's like a therapist for birth, right? Someone who's neutral. Someone who is not necessarily connected to everything that your family may value, right? Who can hear the things that you're saying, and you guys can come up with a plan that is more of what you as an individual want, and not based even on your culture, not based on your history. Doesn't always necessarily put your past medical history against you, right? Which can happen in a hospital. So it's like your therapist. It's like your advocate therapist that is walking with you through this process, that understands where you're at, who's there to reassure you that you are okay, that you are making the best decision. And in my case, really go through the pros and the cons, which a lot of doulas do, and help you come up with a plan that is individualized to you, that makes you feel empowered. And some people might say, well, my sister can do that. She can. Your doula can absolutely be your sister. But sometimes when our sister or our parents are there, they kind of intrude their thoughts on things, right? So we want this to be, like I said, like a therapist, right? Like you can always talk to your best friend, but a therapist is a neutral party, right? A therapist doesn't necessarily put their input like, your sister might, your mom might. And they may be absolutely phenomenal, but they also are going to put in their, let's be honest.
Yeah.
They're going to put in their thoughts. Whereas a doula is a very neutral party that's going to advocate for you.
Right. And yeah, we got a lot of opinions, especially in high stress situations. I understand that now as a sister with a sister who recently was pregnant and gave birth. You got a lot of opinions. You don't need to hear me. And so, let me ask you this: what have been some of your favorite parts of this journey of being able to support families in this way?
So I will always say two of my favorite deliveries were my best friend when I assisted in delivering my goddaughter. Like we were like 21. We didn't know what half of these things were, but I knew enough when she was calling me baking a cake to say, let's count those contractions, right? I remember the OBGYN that she had at the time. Like I was very anxious because I wasn't officially a doula. And he was just like, babies deliver themselves. And I was so annoyed. I'm like, can you please check her? And he was right. Babies do deliver themselves. And I think even coming into this world, I realized part of it was that everybody called me when they were pregnant, right? And I would give the advice and I would, go through different things with them. And what did your doctor say today? And how do you feel about that? And I really enjoyed it because I'm a person, I need to enjoy what I'm doing. Like I need to enjoy what I'm doing. Everybody has a bad day at work, but I truly believe that your profession and what you choose to do with most of your day and most of your life, you got to enjoy it. And I realized that I can enjoy it. And then I realized, wait, I can get paid to enjoy this? Oh, let's go for it. So that was one of my most memorable. And she is now in college and she is striving and she's doing well. And I would say my runner-up would be, I had a patient about a year and a half ago in her late 20s, breast cancer. And let me tell you, she was a warrior. She did chemo throughout her whole pregnancy. They stopped chemo about 3 weeks before her due date because the chemo was putting her into contractions. She was induced. She was able to have a totally unmedicated birth.
Wow.
Beautiful son. And a week later, start back her chemo, and she is now cancer free. So that is definitely always one of my most memorable.
Powerful. And what about some of the challenges that you faced as a doula side by side? Especially, I'm going to include your medical training as well, because I imagine it's different, right? Because now you're stepping into this medical space as the doula, right, versus the nurse.
Correct.
And so what are some of the challenges that you face?
I think some of the challenges is having the two worlds collide, meaning that there are a lot of great doulas, but there are also a lot of doulas who have made a negative name for themselves, especially within the hospital system. And to let the hospital system know, like, I'm not against you. Like, we're working together, During the pandemic, I had a patient, and of course we couldn't go in. So I was on the phone. And the nurse that was in the room was like, who are you on the phone with? And she's like, oh, my doula. And she was already like upset. And literally all I was doing was everything the nurse asked her to do, I was saying it. So the nurse would say, I need you to go on your side. And I would say, hey, can you go on your side? I think it's the best thing for you to do. And she's like, she can't be on the phone. I said, are you listening? Everything you've asked her to do that she's giving you an issue with, she's listening to me.
Right.
I'm supporting you, supporting her. Do you want me to get off the phone for real? She's like, okay, you can stay on the phone. So I think sometimes just that, right? That understand, like, when we're on the same team, we are here for the same purpose.
That's good.
I also think we need to put that out there that, you know, a lot of these nurses and doctors they have their own lived experience, right? And their experience may include neonatal deaths. It may include, you know, losing a patient, and it comes out, right? So sometimes I do find myself having to say, take a step back, even as the doctor, like, take a step back. Listen to what the patient is saying at the moment. She's not saying she's not against you. Or listen to how you're saying it to her. If someone was to speak to you in that manner, like, do you think you would be receptive? I don't think so. You know, I had a birth last night, which was a very long birth. And granted, things were moving in a direction to go towards a C-section. I cannot lie.
Yeah.
However, you didn't have to come in, have someone else come in 5 minutes later, have another person come in 5 minutes later. I'm like, guys, he said she needs to think about it.
Right.
She never said no. She's never said no. I said, you guys have worked with me before. Am I that type of doula? Like, don't we usually get on? Yeah, but she never said no. She said she needs a minute. So why do you think? It's like a parent. If my mom tells me no, do I want to hear my dad say no too? No.
Right.
Like,
I got it. I heard you the first time.
I heard you the first time. Let me have my moment to soak. Come back with my questions, and then we can proceed. Like, you don't need to have that's like, you know, you did something bad and your mother go tell your aunt, and now your aunt call you, and then your cousin. Like, I don't need everyone to call me. And I think even within them, I think we do that too. It's like this, like, well, can she do it in 20 minutes? No, she may not be able to do it in 20 minutes, but she heard you. She said, I'm going to think about it.
That's good.
Well, let her think about it. At the end of the day, this is her delivery. And I think understanding that too, even from the medical point of view, if you've given a patient all of the information that you can, and even if they go against medical advice and something happened, it's not on your conscience. It's not, because you did your part. And I think trying to get the medical team to understand, this is about doing your part. You can get that refusal sign if you need to. Absolutely. It was explained. The client now knows the pros and the cons, and they're taking that risk. You haven't withheld information from them. You haven't withheld treatment from them.
Yeah.
This is their choice, and we have to allow them to make those choices.
Allow those people to make their choice. How do you prepare? So, my heart, I am so amazed by your work, by the work of doulas, by the work of midwives, because it is so heavy emotionally, spiritually, right? It's not, you know, just to your point before, right? Medically, a lot of times you're going through numbers and things like that, but you take on the things that matter to your client. How do you prepare to take on a new mom or a new family as a doula?
Through conversations. There has to be some type of connection, both on their part and mine. I always say this is I will never take it personal if you decide that you don't want me as your doula, because there has to be a connection. You have to know that if I say no, we got to think about this, that you trust me, that we have to think about this. But I also have to trust you that if you say I can do this or I can't, that you really can't. I have to know when to push you. I have to know when to pull back, right? My patient that I had yesterday, she wasn't the type of patient that I can call all the time. I would close her off. So a lot of people will say, well, you didn't give her the support that she needed. You didn't check in after doctor visits, but that wasn't the person that she was.
Yeah.
She needed to digest it with her husband. They needed to come up with something, and then I would call them. And even after calling, like, do you have a question? And she would say, no. And I would say, are you sure? This is your time. I'm like, where's Ted? Let me speak to Ted. And then she'll laugh and she'll say it. And I'll say, I'm going to call you tomorrow. And we always laugh because I never called her the next day, because I just wasn't the type of person that she was. She didn't need that. She needed a lot of space, not necessarily because she was doing different things, but she just wasn't, she's not a person that complains a lot. So she holds a lot of things in, and she needs time to digest it, to feel comfortable to tell someone. But I needed to build that rapport with her to understand this is not a person that we're going to go guns blazing. No, tell the doctor. No, that's just not how she operated. Although she has a very strong personality, she has to be equipped to do that. So she has to think about it, get the information. She's a very information-based person.
Okay.
So she needs to do her research. We need to talk about her research, what was okay to look on Google Doc and what was not okay to look on Google Doc, right? Because everybody knows about Google Doc. And come up with these plans, right? But not every plan, and understand that even when we're given plans that we got to be flexible.
Yeah.
These are words on paper. In the real world, they never come out that way. Never. So we have to be flexible.
But back to your point, right? Individual care.
Individual care.
Are there times where you have turned down a client?
Absolutely.
Yeah.
Absolutely.
And is that, can you say, for example, because I know you said you don't take it personally if a potential client says, no, I don't want you as your doula. What would you say for the parent or the mom or the family that has had a potential doula say, no, this isn't going to work? Like, what should their mindset be? Of course, I'm assuming not to take it personally, but what would you say to them?
I would say, honestly, at the end of the day, it's a trust, right? It's a relationship. And if that person doesn't value you as a person to want you, let it go, right? That's how you have to look at it. You have to let it go because they have to have value in you too, because this is your birth experience. There's a dual value system going on, right? And you need that. Even as a nurse, as a doula, I cry a lot with my patients, and everybody's like, well, you can't cry with patients. Why? Why not? This is a vulnerable time. I gotta find out how mom is doing. Like, I need to know all of the things, because all of these things affect you. Right. If you're fussing with your mom 20 minutes before you go into labor, you think that's not going to be on your mind? It is. So we got to figure out. Sometimes you got to figure out some relationships even prior to. So being a doula is not just about the client; it's about the community, your community. Who do you have? Because I'm not going to be here all the time.
Right.
Right. I only go on call 24/7 at 36 and above weeks. So who do you have within your village?
Gotcha.
We live in a world where a lot of people have moved to different states for job opportunities. So you may not necessarily have that village, right? What village can we create for you? Do you have a meal system in place? Oh, you do cook unity for your meals? Okay. Well, that's your meals, right? So we know before you deliver, we're gonna have a bunch of cook unity meals in your freezer, right? That's you good. Like soups? Okay, we can freeze those. What kind of soups you like? We can make those and freeze those.
Powerful.
No one should be coming to your house the first month if they can't help and they feel uncomfortable to see something out of place. That's not their time to be there. You're not entertaining. Not at all. I should feel comfortable.
Say that again for the people in the back.
You are not entertaining. Absolutely not. If you think you cannot come to my house, or I think you can't come to my house and see something out of place and not judge me for it, then postpartum visits are just not for you. That's not where you should be. This is not an entertaining time. I'm gonna look a hot mess. The house gonna look a hot mess. It's not gonna be perfect. It is not.
That's good.
It is not. You know?
You just came from a delivery, right?
I did.
I got you on here asking you a million questions. How do you decompress? How do you come down after a birth, right? So this is many hours. Labor can be like this, or labor can be like, like, how do you come down after you've gone through this process? You've been up all night.
I think believe it or not, even before a delivery always happens. Like, I nest.
Okay.
Naturally, I nest.
Okay.
So before a delivery, I'm usually up. I'm usually cleaning, oddly enough. I'm usually, I usually, for some reason, I'm like very clingy on my husband right before a delivery. It's very, very weird. And then after, I just think that I've come from a very vain mother. So there's a lot of things about what I do naturally that I think people would call it decompress. Like, I'm that person that gets my nails done every 2 weeks. I get my hair done. So these are things that are a part of my everyday that I think helps. I also almost after every delivery, I speak to my partner and I kind of like talk about what the delivery was for me, what went right, what went wrong, what I think, I could have done better. So I have my community. Community is needed.
Yeah.
Right. And I'm able to vent. I'm able to say all that went right, all that went wrong.
That's good.
And I talk to her a lot. Like that's my go-to after a delivery.
That's great to hear. Because again, I don't want to label it. I've never gone through this experience of my doula. But from the outside looking in, it's just kind of like, how? Like, how do you manage? You want to call it high stress because every situation, of course, may not be that. But again, just watching, in my mind, you guys are superheroes.
Oh, thank you.
Truly. Thank you. And so it's refreshing to know that you have a routine that keeps you going, especially because, again, for me even, right? Like before I knew what doulas were, I didn't know the world even existed. And so then to hear again that you guys are such a support for mom and the family, it's refreshing to know that you have a system in place where you can keep going.
But I think that's honestly within the profession, I think that's the only way to kind of really like to make it, right? You have to somewhat, people say you have to set limits. I don't necessarily think I'm the best at setting limits between myself and my clients, but I would say that I'm pretty good at expressing how I feel, right? So if something made me angry, I'm able to say it. If something made me sad, I'm able to say it. Like something that was joyful, I'm able to see it. And I think there's beauty. This is beauty in birth. Like birth itself is just beautiful. Like there's few things I think that could compare to giving birth. Just seeing what our body can go through, just seeing what a woman goes through. Yeah. It's mind-boggling. Like I will never get bored of giving birth, of assisting giving birth. I just never get bored. Like I just never get bored to see how resilient we are. Never.
So what is it, and this is a broad question, what is it that you feel like specifically the Black maternal health world needs? Again, especially in your experience, you've got, you have the support side as a doula, you have the medical side in general. And again, I know that's wide open, but what do you feel?
What do I feel that we need? Wow. We need our culture to be heard, to be seen. The way we birth to be accepted, right? To understand that it doesn't necessarily look like what others may think it looks like, right? What we may need in that space. A lot of hospitals still only allow one person, or they think that they're being generous by saying you can have one person and your mom. You're one person and your doula. Like, no, I need more than that. Right. I need my annoying aunt that's going to make jokes.
That's good.
I need my mom who is going to kiss my forehead every once in a while.
The village. Yeah.
I need the village, right? I need that. That's going to help me push through. And there is an importance in seeing that and understanding that. You just look at it as a lot of people in the room, just what y'all all need it for. We need to be focused. And I get it, right? I do understand that birth is a very serious thing. Mm-hmm. But there's a lot that comes from our village that helps us get through things. We cry together, we laugh together, we argue. All of that works.
Yeah.
All of that helps us. I remember I saw this reel of this home birth. Mm-hmm. The girl is like yelling and screaming and her grandmother comes in and let's stop all of that. It's time to have the baby. And she got so annoyed, but her pushes became so effective because she needed that.
Right.
As a doula, can I tell you stop all of that? No, I can't. I can say, come on. You need to focus. We're wasting energy. But your grandmother can't. She can come and be like, no, stop all of that. All this yelling for this child. Let's go.
Right. Get it together.
Right. And then you're annoyed, but it's grandma that told you that. So what you gonna do? You're gonna stop that hollering.
Right. Listen.
You're gonna be annoyed, and you're gonna do that effective pushing. That's me.
Right.
She did. And 3 pushes later, she looked up at her grandmother, and the baby was here.
Look, insert eye roll. Thank you, Grandma.
Right. You need that.
Yeah.
You need that. So I think understanding the importance of the village, even if it is, you know what, that they, the same way, like, you know, we have Lamaze classes, have classes that have rules and regulations. Like, this is what, if you're going to be in the room, this is what I need you to do. But I think we need that. I think we need our village.
Yeah.
We need it.
Awesome.
No?
I love that. You may have to add that under your repertoire. Classes for the family. That's good.
I might have to.
I like that.
Might have to. But it's needed. It's really, really needed. And I think even like learning to, like, I'll get a client and I'm like, who doesn't make the decisions? Her grandmother does. So I'll say, bring grandma with her. Or when grandma coming over, I'm gonna come visit you when grandma comes. Because everything I'm asking is like, well, you know, my grandmother wants me to do this, and okay, that sounds good. When's grandma gonna be here next? It don't matter what you want to do, clearly. This is about what grandma wants to do. So it's for me to convince grandma that you need this person, that she just, I don't understand why y'all need these people, and just drink some soup. Everything is a soup and Vicks, right? So I was like, no, grandma, she has to be on medication. She has to be close. I didn't do none of them things, and my children was fine. I gave them cereal. You did, grandma. They are fine, but part of it is that we know a little bit more. That's all the problem. Let's think all and know everything. Nope, we don't. There's so much wisdom in what you said. So although I don't want to give the baby cereal in their bottle, grandma, I think there's so many other things that you have done that I love.
And your sensitivity matters, right? Because even you speaking to, I'm not dismissing you. I appreciate you. I value you. And right, ... which I think is also really important. What are things that you want for expected families to know? Like, if you can give them a little, like, one takeaway, one word of wisdom, well, not one word, words of wisdom, what would that be for the expectant family who's watching this?
Find your village. And understand that your village is not always your family.
Yeah.
Find your village. And find that support. You're going to need it. And it may not be your family. That may hurt. But find your village. Find the people who are going to support you in this time. Because support in pregnancy, sometimes for some people, are a lot different from what support looked like outside of pregnancy. Especially when, you know, we have things like IVF in place. We have adoption in place. We have birth after a miscarriage. We have women having kids in their 40s, right? So when all your friends were having kids, you were the one that didn't. Now they ready to party because their kids in college, and you like, well, I got a newborn now. Can we Can we just do Netflix and a movie? And they're like, girl, we're not Netflix and chill. Absolutely not. So your village may look different, right? Friendships may look different. Doesn't mean that they're not there for you, but it may look different. And adapting to that new norm may be a little hard. So you may have to find the other 40-year-old mom who's having a baby.
That's good.
That's okay.
And that's okay.
And that is okay, right?
Yeah.
Utilize your resources. So if you have that cousin that likes to cook, let her cook. Right? Utilize your resources.
That's good. Thank you. We'll begin to wrap up. And we'll get into the rapid fire, but I want to know first, how can people get in contact with you? How can we support you? Where do we follow you? All the things.
So you can follow me on Instagram, and I'll have you put my Instagram links. You can also contact me via email, as well as 347-372 6391 for either service, or for all three services rather.
Yeah.
But primarily maternal health. And I do consultations, no question is too silly, no question is too big. And I always say, I am that person. I don't pretend to know everything. So you may ask me a question that I don't know,
Right.
but I will tell you I'm not quite sure of that answer. I will find someone who does, and I will get back to you.
That's good. That's good. So we're going to support you. We're going to follow. We're going to check you out. Y'all stalk her out. This is, again, another powerhouse in the community that's available to us. And so we want to make use. So thank you very much. Rapid fire time. Just whatever comes to mind. And this is about you. Okay? So, you ready?
I'm ready. I'm ready, but I'm ready.
Do you have a favorite book?
I don't.
No? Okay.
No.
What about a favorite movie?
Pretty Woman. I think it is the American Cinderella story.
Oh, how freaking cute. Okay. What about a favorite place to go?
The beach.
Oh,
I love going to the beach.
I'm a beach girl too. I'm with you on that. What about a favorite quote?
Prevention is better than cure.
Ooh. Okay. We received that. And then let's see what else. Oh, do you have a favorite or favorites Black-owned brands that you like to support?
Mess in a Bottle.
Mess in a Bottle.
Mm-hmm.
What's that?
So she created she has a t-shirt line. She started off as, I believe, an architect, and she created a t-shirt line, and her line has been in Target. She's been on Shark, I think that's the name of that show that everybody watches. Shark Tank. She's been on Shark Tank. She has reinvented herself so many times. She's really phenomenal.
Mess in a Bottle. Okay, we finna check her out. And what is one word to describe yourself?
One word to describe me. Empathetic.
Empathetic. I get that. I get that. Good word. Good choice. Good choice. And to close out, I'm going to ask you for a humble brag or not so humble brag. What is your superpower? Like, what do you want to leave people with about you?
So I think my superpower is my ability to see the glass as half full and not, to see the glass as half full and not half empty. To see the positivity sometimes in the most glamorous things, right? So things like death, things like sickness, things like a plan not working out the way it needs to work out. Being able to really be like, okay, this wasn't what God wanted for me.
Yeah.
I always, like, every time I lose my keys in the house, I'm just like, all right, can you please hurry up and make whatever is not supposed to be there? Because I gotta go. Like, instead of looking at it as like, oh my God, I can't find my keys, I'm late. I'm just like, is it time for that to go away already so that I can leave and find my keys? And 9 out of 10 times, 10 minutes later, it will be the same place that I already looked at. So
that's good.
It's important to see like the little things, right? The little things that really, really matter. I think I always tell people cancer has always been a double-edged sword for me. And I say that because my mom has been in remission for over 20 years, but my dad also died of it, right? So I was able to see from a very young age, I was able to, unfortunately, kind of have that death on my shoulder. And because of that, it allowed me to view a lot of things differently. I don't hold grudges.
Wow.
I'm able to tell you how I feel and move on. And that's important. It's important not to hold things onto your spirit. That's really, really important. I can tell you how I feel. I can choose to never speak to you again, but I'm not holding on to it.
That's
I'm not holding on to it.
I should tell you are an absolute gift.
Thank you.
I cannot thank you enough again for making the time to share your story, your wisdom about you with me, with the world. I appreciate you. It's been a blessing to
Thank
know
you.
you. I'm grateful to have you in my life and to be able to just see the difference that you're making in the world.
Oh,
Um,
thank you.
and so I honor
Thank you.
you. I'm so grateful. So thank you for being here.
Thank you for having me.
My pleasure. And to all of our lovely viewers, thank you so much for tuning in. Of course, please make sure that you guys follow all the information it is that we put up on the screen. And you guys make sure to tune in to the next episode of For the Culture. Make sure you guys like, comment, subscribe, and stay tuned for what Chocolate Wombs a project is that'll play next. Peace, love, and blessings. And we'll catch you guys later. Bye.
Bye.
Hi, everyone. Katia here. And first and foremost, I want to say thank you so much for tuning in to this episode of For the Culture, Chocolate Wombs. It means the world to me to have your support. And so please continue to share, to like, to subscribe so we can get this information out to as many as possible, share the importance of Black maternal health, and of course, celebrate the heroes in our community that are keeping us going and keeping our community and our mamas thriving. Now, I want to invite you to participate and join in Chocolate Wombs, the project. So K4 Kumba Inc. is fundraising. We are choosing to create a world where birthing is a safe and joyous experience for every mother, regardless of what they look like or where they come from. And so that's where you come in. Go to chocolatewombs.eventbrite.com to tune in, to register for this year's Chocolate Wombs event. Everyone is invited, not just expectant families, because this is a community conversation. You can get all the details about the event there, and you can also donate to our cause. We're fundraising so that we can cover the cost of Black maternal health services. We want to be able to make sure that every family has access to doulas, has access to perinatal chiropractic care, and the list goes on. And we'd love for you to help us to make that happen. And so please be a part of our initiative. You can check us out on GiveButter. Make sure that you follow us on Instagram and stay tuned to what it is that we have happening next. I love you all. See you soon. Peace, love, and blessings.